ECG interpretation is one of the most intimidating topics in nursing. The lines look complex, the rhythms seem unfamiliar, and many students believe this skill belongs only to doctors or critical care specialists. As a result, they approach ECGs with fear instead of understanding. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. In reality, nurses are not expected to diagnose heart conditions from an ECG. They are expected to recognize normal patterns, identify dangerous rhythms, and act quickly when something is wrong. ECG monitoring exists to provide early warning before cardiac problems become life-threatening. Think of an ECG like listening to music. You do not need to read sheet music to notice when something sounds off. A sudden change in rhythm, speed, or pattern immediately catches attention. ECGs work the same way. Once you understand the normal rhythm, abnormal patterns become easier to recognize. At the bedside, nurses focus on a few essential features. Is the rhythm regular or irregular? Is the heart rate too fast, too slow, or appropriate for the situation? Are there signs that electrical conduction is disrupted? These observations guide immediate nursing actions and escalation of care. Understanding basic ECG components helps build confidence. The P wave represents atrial activity. The QRS complex reflects ventricular contraction. The T wave shows recovery. Nurses do not need advanced calculations. They need to recognize when these elements are missing, abnormal, or occurring at dangerous rates. In clinical practice, ECG monitoring supports patient safety in many settings. Emergency departments, intensive care units, telemetry floors, and even post-operative units rely on nurses to identify rhythm changes early. Delayed recognition can lead to rapid deterioration. The nclex tests ECG knowledge through scenarios rather than technical detail. Questions often describe rhythm changes alongside patient symptoms. The correct response usually involves recognizing instability, assessing the patient, and notifying the healthcare team promptly. The exam values safety and prioritization over perfect interpretation. Experienced nurses use ECGs as part of a larger picture. A rhythm is never interpreted in isolation. Vital signs, symptoms, oxygenation, and mental status all matter. A rhythm that looks abnormal on paper may be less concerning than a patient who suddenly becomes unstable. In real nursing practice, confidence with ECGs grows through pattern recognition and repetition. Nurses learn to trust what looks normal and question what does not. This mindset transforms ECG monitoring from a source of anxiety into a valuable clinical tool. Now that you understand ECGs as patterns rather than complex formulas, the next step is applying this knowledge in emergency situations where rhythm recognition guides rapid response. That real-world application is where understanding becomes skill, and that's exactly where we'll go next here at the Learning Studio.